There are differences between the adult and the pediatric care, and one example of that, which I think is really relevant and significant, is the fact that we in pediatrics do all our endoscopic procedure under general anesthetic, whereas in the adult world this unfortunately is not possible. And certainly the frequency of which children are seen in clinic is different in the sense that we routinely organize follow-ups every 3 months, whereas in the adult service it's pretty much up to the patient to ring up when things are not going according to plan. But what we hope to achieve is that we make this process as seamless as possible. And the way that we do that is try to work as a team with our adult colleagues. It's not uncommon for patients to have to undergo surgical procedures during the transition phase or important decisions about their management, and we try to share this decision-making process with our adult colleagues and sometimes also with the adult surgeons to make sure that everything is shared and agreed so that the process is as seamless as possible.
So I work as a clinical psychologist, which means that we are here to support you on this transitional journey. Now, part of that means that we are there when you're both an inpatient or an outpatient, and we can provide support through talking therapies, which means that we can discuss with you about your concerns and your anxieties, both about the symptoms of IBD itself, but also about some of the treatment options that you will have available for you.
So as a youngster under the paediatric service, of course, you'll have been familiar with coming to appointments, often with your mother or father, and they'll be sitting in and helping you steer things along. Of course, within the adult service, you're now an adult, and we like to treat you as such. So very much you'll be much more in control of your own treatment, probably organising your appointments. Of course, your parents can get involved in the early days while you're just making this transition, but you should take responsibility for sorting out appointments. If, for example, you need to phone up the IBD telephone helpline, then you should make the call, not necessarily your mother or father, and be there to receive the call back so that you can just tell us about your symptoms and we can help you very directly. So it does feel a little uncomfortable when you're first starting to do this. Of course, your parents are welcome to engage with it, but you need to think through whether you want mum and dad sitting in on your appointments, or maybe you've reached a time in your life where actually you don't want them, and you can ask them politely just to stay in the waiting area while you come in and talk to the doctors and talk to our medical teams and nursing teams about the problems that you're experiencing. So feel free to do that, and we can encourage and support you with that.
So I was 15 when I was diagnosed with IBD colitis. It was in the summer of 2016. And basically the transition from paediatric to adult clinic, the thing that I found most fearful was probably just not having someone there all the time to constantly look after you was one of the main things I was worried about. Also the fact that if you were to come in, you would have to wait to be seen, because again there's a lot of people in the adult clinic more than the paediatric, so you will have to wait just a few more minutes than what you would have to usually at the paediatric just to be seen by a doctor or nurse. But yeah, overall it's been not too bad for me, to be honest. I found the experience quite smooth transitioning from paediatric to adult. Like I say, the only few things was just having to wait on the phone if you were to have a flare up, but other than that I found it alright.
I wasn't particularly worried. Luke's quite mature for his age, so I didn't really think that he was going to suffer in any way. And we had a meeting with both teams, so we discussed anything then and there, if there was going to be any issues, and how the clinics varied as well. Because obviously, when you're in paediatrics, I think you're a little bit more cushioned. You know that they're always going to be there at a drop of a hat, and when Luke's had a flare-up before, we've managed to get him in near enough the same day, if not the next day. Whereas adult clinic is slightly different. You obviously need to ring up, you leave a message, and then you have to wait for somebody to get back to you. So, there are slight subtle changes, but I knew that Luke would be okay with it.
One of the important things that we know is that this is a process, so we're going to take it slowly and explain to you how we move forward so that you can become independent in your adult life. We've talked a little bit about your parents and how they've been very involved and worked with us as part of a team to look after you since you've been diagnosed with your IBD. But as you start to move forward in life, moving on to college, perhaps even going to university and moving away from home, you're going to need to know how to look after yourself, how to contact the IBD team so that if you become poorly, you can get the support that you need to prevent yourself from having a longer relapse. We need you to know how to be prepared to ask some questions when you come to clinic and be able to speak to the adult healthcare professionals, because they will expect to speak to you a lot more than we've done when we've been speaking to your mum. Or dad, whoever's come to clinic with you. We know that it's hard for them to let go, but we do need them to encourage you to be more independent. So the next time they're getting a prescription, or if you need to change an appointment, maybe they could encourage you to make that phone call yourself or to ask for a repeat prescription.
We realize that indeed transition is a stressful process, but all of us are here to support you to make it happen in the nicest possible way.